Hi there, my name's Tom Ford. I'm a cardiologist and I've come back to Scotland from a period of time overseas in Australia, specifically with the aim of joining the British Heart Foundation Centre of Excellence here and performing a translational clinical research project. So Glasgow has some fantastic research infrastructure, and that's combined with a patient's population which has sadly got too much heart disease. In fact, it's one of the highest prevalence of heart disease in the Western world. I'm joining Professor Berry and a team of leading interventional cardiologists at the Jubilee Hospital, and we're interested in the effects of blood pressure on the small arteries in the heart. So traditionally, most of the focus in coronary artery disease is on blockages in the arteries, which you can see on an angiogram. The angiogram is the diagnostic test to look for blockages that could cause angina. And Professor Berry and I are doing a research project where we now have the tools to detect any changes in the small blood vessels, and this is typically due to long-standing high blood pressure or other cardiovascular risk factors. So this study is a translational clinical project, and we're finding different types of cardiovascular abnormalities and specifically different patterns of small vessel disease. And we're taking the research a step further at looking at the mechanisms by which these small vessels react outside of the body, by doing biopsies of skin and small blood vessels. The impact that we hope to make, firstly, is to evaluate whether doing extra tests to prove or disprove whether these small arteries are causing a problem, whether doing these tests actually makes a difference to people's quality of life, as well as their severity of angina. And we may be in a position where we change the current practice, which is currently focused predominantly on how an artery looks rather than how an artery behaves under different scenarios.